Richter's hernia management. Note: high index of suspicion needed. CT scan for diagnosis. Urgent surgery required. Reduce incarcerated bowel segment. Assess bowel viability. Perform bowel resection if needed. Repair hernia defect. Consider mesh for large defects. Spigelian cryptorchidism syndrome repair approach. Note: inguinal and lateral abdominal incisions. Repair Spigelian hernia with mesh. Identify and mobilize undescended testicle. Perform orchiopexy. Ensure closure of lateral abdominal wall defect. Consider single-stage versus two-stage approach. Spigelian hernia repair technique. Note: transverse incision over hernia. Divide external oblique aponeurosis. Identify hernia sac at semilunar line. Reduce contents. Excise or invert sac. Close fascial defect. Consider mesh placement. Ensure watertight closure of external oblique. Sports hernia, athletic pubalgia. Repair. Note: inguinal approach. Identify external oblique aponeurosis. Release tension on rectus abdominis. Reattach rectus tendon to pubic tubercle. Reinforce posterior wall of inguinal canal. Consider adductor longus tendon release if needed. Sportsman's hernia, Gilmore's groin repair. Note: inguinal approach. Identify external oblique aponeurosis. Repair posterior wall weakness. Reattach conjoint tendon to inguinal ligament. Release adductor longus tendon origin. Reinforce external oblique. Consider mesh placement. Stop a procedure for bilateral inguinal hernias. Note: lower midline incision. Enter preperitoneal space. Dissect bilateral myopectineal orifices. Reduce hernia sacs. Place large mesh to cover both sides. Secure mesh to Cooper's ligament and abdominal wall. Close peritoneum over mesh. Laparoscopic repair of subxiphoid incisional hernia. Note: supine position. 3 to 4 ports. Reduce hernia contents. Dissect adhesions. Identify xiphoid process and costal margins. Place large mesh to cover defect and overlap healthy tissue. Secure mesh with tacks and transfascial sutures. Peristomal hernia repair. Sugarbaker technique. Note: laparoscopic approach. 3 to 4 ports. Reduce hernia contents. Dissect adhesions. Measure defect. Cut large mesh with central keyhole. Place mesh to cover defect and create lateral tunnel for bowel. Secure mesh with tacks and sutures. Laparoscopic repair of suprapubic hernia. Note: supine position. 3-4 ports. Reduce hernia contents. Dissect adhesions. Identify pubic symphysis and Cooper's ligaments. Place mesh to cover defect and fix to Cooper's ligaments. Secure mesh with tacks and transfascial sutures. Laparoscopic repair of supravesical hernia. Note: supine position. 3 to 4 ports. Reduce hernia contents. Identify defect superior to bladder. Dissect hernia sac if present. Close fascial defect with sutures. Place mesh to cover defect and fix to Cooper's ligaments. Secure with tacks and sutures. Laparoscopic inguinal hernia repair. TP approach. Note: preperitoneal space entry. 3 ports. Create space with balloon dissector. Identify anatomical landmarks. Reduce hernia sac. Place mesh to cover myopectineal orifice. Secure mesh. Check for peritoneal defects. Deflate preperitoneal space. Laparoscopic repair of traumatic diaphragmatic hernia. Note: supine position. 3 to 4 ports. Reduce herniated organs. Assess for associated injuries. Debride edges of diaphragmatic defect. Close defect with non-absorbable sutures. Reinforce with mesh if needed. Check for hemostasis and lung expansion. Laparoscopic repair of trocar site hernia. Note: port placement away from previous sites. Identify hernia defect. Reduce contents. Excise hernia sac if needed. Close fascial defect with sutures. Place mesh to cover defect and overlap healthy tissue. Secure mesh with tacks and sutures. Amiens hernia repair technique. Note: inguinal approach. Open hernia sac. Identify appendix. Assess for appendicitis. Perform appendectomy if inflamed. Reduce normal appendix without removal. Repair hernia defect. Avoid mesh if appendectomy performed. Close in layers. Laparoscopic repair of bilateral inguinal hernias. TAP approach. Note: supine position, 3 ports. Create peritoneal flaps bilaterally. Reduce hernia sacs. Dissect preperitoneal space on both sides. Place and secure mesh bilaterally. Close peritoneal flaps. Check for hemostasis and proper meshplasm. Laparoscopic repair of posterolateral diaphragmatic hernia. Bochdalic. Note: lateral decubitus position. 3 to 4 ports. Reduce herniated organs. Dissect hernia sac if present. Identify posterolateral diaphragmatic defect. Close defect with non-absorbable sutures. Place mesh for reinforcement. Secure by component separation technique for large ventral hernias. Note: midline incision. Dissect skin flaps. Incise external oblique aponeurosis lateral to rectus sheath. Separate external and internal oblique muscles. Advance rectus muscles medially. Close fascial defect. Consider mesh reinforcement. Laparoscopic repair of Bochdalic hernia. Note: lateral decubitus position. 3 to 4 ports. Reduce hernia contents. Dissect hernia sac if present. Identify diaphragmatic defect. Close defect with non-absorbable sutures. Place mesh for reinforcement. Secure mesh with tacks or sutures. Femoral hernia repair. McVeigh technique. Note: inguinal incision. Open inguinal canal. Identify femoral hernia sac. Reduce contents. Excise or invert sac. Suture conjoint tendon to Cooper's ligament. Close femoral canal. Consider relaxing incision in rectus sheath. Laparoscopic Morgagni hernia repair. Note: 3 to 4 ports. Reduce hernia contents. Dissect hernia sac if present. Identify landmarks: sternum, diaphragm, pericardium. Close defect with non-absorbable sutures. Place mesh over repair. Secure mesh with tacks or sutures. Check for hemostasis. Degarangiots hernia management. Note: inguinal approach. Open hernia sac. Identify appendix within femoral hernia. Assess for appendicitis. Perform appendectomy if inflamed. Reduce normal appendix. Repair femoral hernia defect. Avoid mesh if appendectomy performed. Laparoscopic repair of flank hernia. Note: lateral decubitus position. 3 to 4 ports. Identify hernia defect. Reduce contents. Dissect hernia sac if present. Place large mesh to cover defect and overlap healthy tissue. Secure mesh with tacks and transfascial sutures. Ensure hemostasis. Umbilical hernia repair technique. Note: infraumbilical curved incision. Dissect hernia sac from surrounding fascia. Reduce contents. Excise redundant sac. Close fascial defect with non-absorbable sutures. Consider mesh for defects. 1 cm. Ensure tension-free repair. Close skin. Giant hiatal hernia repair technique. Note: laparoscopic or open approach. Extensive mediastinal dissection. Reduce stomach and other contents. Excise hernia sac. Perform esophageal lengthening if needed. Close crura with plegited sutures. Reinforce with mesh. Perform fundoplication. Grinfelt hernia repair approach. Note: prone or lateral position. Incision over superior lumbar triangle. Identify hernia sac. Reduce contents. Excise or invert sac. Close fascial defect with non-absorbable sutures. Consider mesh reinforcement. Ensure layered closure of muscle and fascia. Laparoscopic hiatal hernia repair. Note: 4 and 5 ports. Reduce hernia contents. Dissect hernia sac from mediastinum. Mobilize esophagus. Close crura with non-absorbable sutures. Consider mesh reinforcement. Perform fundoplication if needed. Check for tight closure without tension. Incarcerated femoral hernia emergency repair. Note: infrainguinal approach. Identify and open femoral canal. Reduce incarcerated contents. Assess bowel viability. Perform bowel resection if needed. Close femoral ring with non-absorbable sutures. Consider mesh plug if no resection performed. Interparietal inguinal hernia repair technique. Note: inguinal approach. Identify hernia sac between muscle layers. Dissect sac from surrounding tissues. Reduce contents. Close muscular defect with sutures. Consider mesh placement for reinforcement. Ensure layered closure of muscle and fascia. Laparoscopic ventral hernia repair. Note: 3 to 4 ports. Reduce hernia contents. Dissect adhesions. Measure defect. Cut mesh to size. Overlap defect by 3-5 cm. Insert mesh. Secure with transfascial sutures and tacks. Ensure flat mesh placement. Check for hemostasis. Laparoscopic repair of interparietal hernia. Note: 3 to 4 ports. Identify hernia sac between muscle layers. Reduce contents. Dissect sac from surrounding tissues. Close muscular defect with sutures. Place mesh to cover defect and overlap healthy tissue. Secure mesh with tacks and sutures. Littrer's hernia repair approach. Note: inguinal or umbilical incision based on location. Open hernia sac. Identify Meckel's diverticulum. Assess diverticulum viability. Perform diverticulectomy if needed. Reduce bowel. Repair hernia defect. Consider mesh if no resection performed. Laparoscopic repair of lumbar hernia. Note: lateral decubitus position. 3 to 4 ports. Identify anatomical landmarks. Iliac crest, quadratus lumborum, latissimus dorsi. Reduce hernia contents. Place large mesh to cover defect. Secure mesh with tacks and transfascial sutures. Laparoscopic repair of lumbar incisional hernia. Note: lateral decubitus position. 3 to 4 ports. Reduce hernia contents. Dissect adhesions. Identify borders. Iliac crest, paraspinal muscles, costal margin. Place large mesh to cover defect. Secure with tacks and transfascial sutures. Ensure hemostasis. Incisional hernia. Repair: open approach. Note: incision over hernia. Dissect hernia sac. Reduce contents. Excise sac if needed. Identify healthy fascia edges. Place mesh in sublay position. Secure mesh with transfascial sutures. Close fascia over mesh if possible. Place drains if needed. Inguinal hernia repair. Liechtenstein technique. Open approach. Inguinal incision. Identify external oblique aponeurosis. Open inguinal canal. Reduce hernia sac. Place polypropylene mesh over transversalis fascia. Secure mesh to inguinal ligament and conjoint tendon. Close external oblique aponeuros. Laparoscopic repair of Morgani-Larry hernia. Note: supine position. 3 to 4 ports. Reduce hernia contents. Dissect hernia sac if present. Identify bilateral anterior diaphragmatic defects. Close defects with non-absorbable sutures. Place mesh for reinforcement. Secure mesh with tacks or sutures. Obstructed inguinal hernia emergency repair. Note: inguinal approach. Open external oblique aponeurosis. Identify and open hernia sac. Assess bowel viability. Perform bowel resection if needed. Reduce viable contents. Repair hernia defect. Avoid mesh if bowel resection performed. Obturator hernia emergency repair technique. Note: lower midline incision. Enter preperitoneal space. Identify obturator canal. Reduce hernia contents. Assess bowel viability. Perform bowel resection if needed. Close obturator canal with sutures or mesh plug. Check femoral vessel's integrity. Obturator hernia repair approach. Note: lower midline or inguinal incision. Identify obturator canal. Reduce hernia sac. Close obturator canal with sutures or mesh plug. Consider preperitoneal mesh placement for reinforcement. Check femoral and inguinal regions for associated hernias. Laparoscopic repair of peristomal hernia. Keyhole technique. Note: 3 to 4 ports. Reduce hernia contents. Dissect adhesions. Measure defect. Cut mesh with central keyhole. Place mesh around stoma. Secure mesh with tacks and transfascial sutures. Ensure flat mesh placement and patency of stoma. Laparoscopic repair of peristomal hernia. Modified sugar-baker technique. Note: 3 to 4 ports. Reduce hernia contents. Dissect adhesions. Measure defect. Cut large mesh with central keyhole. Place mesh to cover defect and create lateral tunnel for bowel. Secure mesh with tacks and sutures. Create pero. Laparoscopic repair of peristomal hernia. Sandwich technique. Note: 3 to 4 ports. Reduce hernia contents. Dissect adhesions. Place first mesh in intraperitoneal position around stoma. Place second mesh in onlay position. Secure both meshes with tacks and transfascial sutures. Ensure stoma patency. Repair of interparietal inguinal hernia in pediatrics. Note: inguinal approach. Identify hernia sac between muscle layers. Dissect sac carefully. Reduce contents. Close muscular defect with absorbable sutures. Avoid mesh in children. Ensure high ligation of hernia sac. Close each layer meticulously. Litra's hernia repair in pediatric patients. Note: inguinal approach. Open hernia sac. Identify Meckel's diverticulum. Assess viability. Perform diverticulectomy if needed. Reduce bowel. Close internal ring. Avoid mesh in children. Ensure high ligation of hernia sac. Peterson's hernia repair in post-gastric bypass patients. Note: high index of suspicion in post-RIGB patients with abdominal pain. CT scan for diagnosis. Laparoscopic approach. Reduce herniated bowel. Close Peterson's defect with non-absorbable sutures. Check for other internal hernias. Laparoscopic repair of postoperative diaphragmatic hernia. Note: supine position with reverse Trendelenburg, 3 to 4 ports. Reduce herniated organs. Dissect adhesions carefully. Identify diaphragmatic defect. Close defect with non-absorbable sutures. Reinforce with mesh. Secure mesh with tacks or suture. Recurrent inguinal hernia repair. Anterior approach. Note: inguinal incision. Dissect through scar tissue. Identify cord structures. Reduce recurrent hernia sac. Remove old mesh if present. Place new preperitoneal mesh. Secure to Cooper's ligament and inguinal ligament. Close in layers. Recurrent umbilical hernia repair approach. Note: periumbilical incision. Dissect through scar tissue. Identify recurrent hernia sac. Reduce contents. Excise redundant sac. Close fascial defect with non-absorbable sutures. Place mesh in sublay position. Ensure tension-free repair. Retrosternal hernia repair technique. Note: supine position. Upper midline or thoracic approach. Reduce hernia contents. Dissect hernia sac from retrosternal space. Close fascial defect. Consider mesh reinforcement. Ensure proper drainage to prevent seroma formation.